This is going to be a presentation on breast cancer. We're going to be covering the signs and symptoms, causes, prevention, how to perform a self-examination, and treatments. First, we need to understand what breast cancer is. Breast cancer is the most often diagnosed life-threatening disease in women. It is the second leading cause of death in women after lung cancer. Breast cancer starts in the breast when the cells of the tissue begin to grow out of control. This disturbed growth of cells leads to formation of tumors and lesions. A normal cell can become a cancer cell if it undergoes damage to the DNA. More than 1 million new cases of breast cancer are diagnosed every year globally, and more than 400,000 deaths occur to this pathology. Male breast cancer accounts for less than 1% of total cases. In men, symptoms, diagnosis, and management are the same. Breast cancer is a malignant tumor that starts in the breast and can be found in both women and men. Breast cancer can either be invasive or non-invasive. Non-invasive breast cancer cells remain in a particular location of the breast, without spreading to surrounding tissue, lobules, or ducts. Non-invasive breast cancer includes ductal carcinoma, which stays inside the milk duct, and lobular carcinoma, which is an overgrowth of cells that stay within the lobule. These cancers do not spread to other healthy tissue or other areas of the body. Invasive breast cancer cells break through the normal breast tissue barriers and spread to other parts of the body through the bloodstream and lymph nodes. There are some cancers that start in tissues other than the breast, but may spread to the breast. These cancers are called sarcomas and lymphomas and are not really thought of as breast cancers. Invasive breast cancer cells break through normal breast tissue and barriers and spread to other parts of the body through the bloodstream and lymph nodes. These include invasive ductal carcinoma. It is the most common type of breast cancer. It begins in the milk duct but has grown into the surrounding normal tissue inside the breast. Invasive lobular carcinoma starts inside the lobule but grows into surrounding normal tissue inside the breast. Inflammatory breast cancer is a fast-growing form of breast cancer that usually starts with the reddening and swelling of the breast instead of a distinct lump. Recurrent and/or metastatic breast cancer is a breast cancer that has returned after previous treatment or has spread beyond the breast to other parts of the body. Symptoms of breast cancer can often be difficult to detect in its early stages. While some with breast cancer will experience lumps, pain, swelling, and skin changes, others may experience no obvious symptoms. Some common signs and symptoms of breast cancer include a lump or mass in the breast that feels different from the surrounding tissue, a change in the shape, size, or appearance of the breast, a breast rash, changes in the skin over the breast, for an example dimpling, breast pain, inverted or pulling in of the nipple, scaling, peeling, or flaking skin of the breast, particularly in the dark area around the nipple, redness and or pitting in the breast skin, resembling the skin of an orange, and discharge from the nipple. Breast cancer is caused when a cell's DNA becomes damaged. Some causes can be genetic or environmental, but most commonly it is caused by a combination of the two. The why and how are still widely unknown, therefore doctors rarely know exactly what causes one woman to have breast cancer, while another woman does not. Most women who develop breast cancer are never able to pinpoint a specific cause. Approximately 60 to 70% of women with risk factors never develop breast cancer, while 30 to 40% of women without factors will develop cancer. Breast cancer does not discriminate. Risk factors for breast cancer can be genetic, which are factors that you have no control over, while the others are environmental, which you have control. Some of the most common genetic risk factors would be your family history. Women with close relatives who've been diagnosed with breast cancer have a higher risk of developing the disease. Gender, just being a woman, is the biggest risk factor for developing breast cancer. Age, as with many other diseases, increases your risk of breast cancer, especially as you get older. About 2 of the 3 invasive breast cancers are found in women 55 or older. Last but not least would be your menstrual cycle. Women who started menstruation, having periods, younger than the age of 12 have a higher risk of breast cancer later in life. And the same is true for women who go through menopause when they're older than 55. These are just a few of the genetic factors which you cannot change. Now some of the environmental factors which you can change would be physical inactivity. Research shows a link between exercising and a lower risk of breast cancer. Smoking causes a number of diseases and is linked to a higher risk of breast cancer in younger, premenopausal women. Alcohol use. Research consistently shows that drinking alcoholic beverages, such as beer, wine, and liquor, increases a woman's risk of breast cancer. And lastly, eating an unhealthy diet. Diet is thought to be at least partly responsible for at least 30 to 40% of all cancers. Some of the common misconceptions when it comes to actually getting breast cancer would be that if you maintain a healthy weight and exercise regularly, then you would not have to worry about getting breast cancer. However, this is just not the case. Although these behaviors can drastically decrease the risk of breast cancer, it does not fully eliminate it. Next, there is a myth that if you do not have a family member who previously had breast cancer, then you cannot get it. However, most people who are diagnosed with breast cancer have no known family history. And lastly, many people believe that wearing a bra with underwire can cause you to get breast cancer, and that is simply not true. There is absolutely zero evidence that states that bras cause breast cancer. Prevention is the most important step when it comes to breast cancer treatment. The most crucial step any woman can take to reduce the risk of dying from breast cancer is to have regular mammogram screenings. If a lump is suspected, consult your doctor. Your doctor may want you to get a biopsy, which is a minor procedure where they take a sample of breast tissue, and this is the only way for sure if a lump is cancerous or not. Research suggests that for every 12 months a woman breastfed her child or children, her risk of getting breast cancer is decreased by 4.3%. And of course, proper diet and exercise and limiting alcohol use are important to maintaining a healthy body in general. Lastly, it's important to learn how to perform a self-examination of your breast. What is breast self-examination? It is a screening method that can be used to detect malignancies in the tissues of the breast in the early stages of breast cancer. This exam can be done in the comfort of your own home at your own convenience, while at no cost to yourself. A breast self-examination can be done in 5 easy steps. Step 1. You will need to stand and look at yourself in the mirror with your shoulders straight and your hands on your hips. Look at your breasts to confirm that they are the usual shape and color. You want to look for specific changes such as dimpling, puckering, or any bulging of the skin on the breast, as well as any redness, soreness, rashes, or swelling located on the breast. Look for any nipple changes, such as inverted nipples or change in position of the nipples. Step 2. You need to lift your arms straight above your head and examine your breast in the mirror for the same changes I mentioned. Step 3. Examine for any nipple discharge. Step 4. You will need to lie down for this step. You are going to examine one breast at a time, using your right hand to feel your left breast, then your left hand to feel your right breast. When you get ready to feel each breast, place the arm of the breast you're going to examine above your head. Use your first few fingers, keeping them side by side. Use a circular motion to examine the entire breast. It is easier to begin at the nipple and work your way outwards. You want to feel all the breast tissue, so use light pressure to feel the tissue closest to the skin. Then you need to increase the pressure all the way until you feel your rib cage. Lastly, in step 5, you need to feel your breast while sitting or standing. It is easier for most women to self-examine in the shower while the skin is wet. Use the same hand movements mentioned in step 4. If you find any inconsistencies, arrange an appointment with your doctor to rule out any potential malignancies. Why is self-examination so important? In 5 simple steps, you can become familiar with your own breasts so you can point out any potential issues that may arise. Also, when breast cancer is found early, it has better outcomes with treatment. Self-examinations, combined with other screening such as mammograms, increases the odds of early detection. Johns Hopkins Medicine says that 40% of all diagnosed breast cancers are detected by women who feel a lump during self-examination. It is very important that you complete self-examinations regularly. There are many different ways to treat breast cancer. One of the most well known is a mastectomy, which is the surgical removal of the affected breast. Another surgical procedure is the lumpectomy. It is known as a breast conserving surgery. In a lumpectomy, they remove the tumor with only a small amount of breast tissue. And then we have chemotherapy, and they do something called neoadjuvant therapy, which is used to shrink the tumor before it's surgically removed. And by removing the tumor, it reduces the risk for local reoccurrence. And then we have hormonal therapy. This blocks cancer cells from getting the hormones they need to grow. Biological therapy works with your immune system to fight cancer off or to control the effects of other treatment. And then we have radiation therapy. Radiation therapy is generally used after a breast conserving surgery to kill any remaining cancer cells that may have been around the removed tumor. An advantage of this treatment is that it's given within a short time interval. So for those who may have to travel a long distance to get to a cancer center, this will eliminate their need for daily trips like it would for other treatments that they would have to take. This is a graph of the percent of people younger than 65 years of age with a disability in Etowah and surrounding counties, as well as the lowest and highest percent counties in all of Alabama. Etowah is at 14.8%, Shelby is the lowest at 7.4%. Choctaw isn't a surrounding county, but it's at the highest percent county in Alabama at 21.2%. According to Healthy People 2020 initiatives, 2 important steps to preventing breast cancer would be having proper access to health care services and maintaining a proper nutrition and weight status. Access to comprehensive, quality health care services is important for promoting and maintaining health, preventing and managing disease, reducing unnecessary disability and premature death, and achieving health equity for all Americans. Some barriers to health care would be a delay in receiving appropriate care and financial burden, food assistance program availability, and economic price systems. Health insurance coverage helps patients gain entry into the healthcare system, and the lack of adequate coverage makes it difficult for people to get the health care they need. And when they do get care, it burdens them with large medical bills. However, according to the Census Bureau, the local population data shows approximately 17.5% of the local population is living in poverty, and 12.5% of people do not have health insurance. These are health disparities that Healthy People 2020 are trying to overcome. This graph is the percent of people younger than 65 years old without health insurance in the surrounding counties, along with the highest and lowest percent in all counties of Alabama. Etowah is at 12.5%, Shelby is the lowest with 8.1%, and DeKalb is the highest with 18.8%. Alabama continues to reject the Medicaid expansion under the Affordable Care Act, even though approximately 314,000 people would benefit from the expansion. As a result, there are thousands of Alabama residents alone who live in poverty and without health care coverage. We have 4 online resources listed for application of health care coverage for low-income and/or disabled individuals and families. In conclusion, breast cancer can be an aggressive disease, but with prevention and early detection such as self-examinations, it can be found early on, giving you or a loved one a better outcome with treatment. This presentation was made by Melissa McGrady, Kelsey Williams, Vanessa Hicks, Jennifer Voss, and Julia Davis. And lastly, here are some of the sources we used to gather the information for this project.